Hello everybody. Today I will be discussing outpatient care between the US and Ireland. First, we must understand what exactly outpatient care is and how does it play into different healthcare systems. And it refers to any healthcare service that does not require an overnight stay in a healthcare institution. Some different settings of outpatient care are freestanding facilities, mobile facilities. For example, where I'm from, we have a mobile dentist and a mobile sonogram unit. Hospice care, public health services, community health centers, etc. Just some further information and a couple of different examples. The freestanding clinics, which we know commonly as walk-in clinics or urgent care centers, provide outpatient services that are used on an episodic basis. This is where my parents would take me when I thought I broke a bone, and the provider would either send me out for an x-ray or provide it in-house, and we would go from there to get casted up. Some of the strengths of walk-in clinics are convenience of location, accessible hours, and a no-appointment basis, which is great when you're experiencing something acutely. That would be like making an appointment at the ER. Community health centers, we're going to discuss these in more depth in a little bit. And I threw in alternative medicine clinics, including meditation, yoga, acupuncture, as well as even massage and chiropractic care, just because they are not widely accepted by insurance as well as Western medicine. So we have some growth to do in that area. So a primary part of outpatient care is the primary care structure. And the conceptual foundation for all outpatient services, but not all outpatient care, is primary care. The World Health Organization defines primary care as essential health care that is based on practical, scientifically sound, and socially acceptable methods of technology for care. Primary care is intended to be the first contact between individuals, family, community, and the healthcare delivery system. There are 3 parts of the primary care foundation, and primary care encompasses basic routine health services such as education, counseling, and prevention, with an emphasis in prevention. Secondary care includes hospitalization, routine surgery, specialty consult, and rehabilitation, so would take care of some more serious health concerns. Tertiary care is required for uncommon surgeries such as burn treatment, trauma care, or major internal surgery, for example. So the different domains of primary care interact and work together. And the first domain we'll glance over is points of entry. It is the first contact with the patient. The primary care providers act as gatekeepers to refer patients to specialists. So because the primary care provider should have had a relationship with their patient, because their patient sees them on a regular basis, they will be able to better diagnose and refer to certain specialists. Community-based primary care must be accessible, otherwise how can people get the care? Coordination of care, continuation of care / continuity of care are buzzwords within the health community, and everybody is striving towards it, and it is an integration within overall healthcare providers. Essential care, primary care is essential care. Populations are healthier when they can receive health care. Integrated care embodies and coordinates continuous services, a seamless care model. And accountability, both clinicians and patients are held responsible within their arenas on how to attain the overall health goal. We know primary care works. Primary care provides early intervention testing, for example, cholesterol testing to prevent heart disease. A startling statistic is one primary care physician per a population of 10,000 has an average reduction of 127,000 plus deaths per year. And a lot of those are with non-communicable, preventable diseases. Primary care reduces hospitalization and use of emergency care. The data supports it. Primary and preventative care work together. I will further discuss the U.S. versus Ireland outpatient care. I will review the US and Ireland healthcare systems, compare how each healthcare system incorporates outpatient care, the strengths and weaknesses, as well as recommendations for improvement. Here are some United States statistics. I would like to emphasize the non-communicable disease rate, which is 413 per 100,000 people. The U.S. healthcare system, as we have reviewed, is a hodgepodge / disaster. It is fragmented between private insurance and public programs. An interesting statistic is hospitals average 2.6 community hospital beds per 1,000 people. That is alarming. I'm sure maybe this statistic has changed since COVID. One of the lowest hospital stay averages in the world. They kick you out at 5 days. It seems that's the median. Overloaded emergency rooms used for non-urgent care. I saw this all the time when I worked in social work. U.S. outpatient care. So home health is a growing industry. Instead of sticking people in nursing homes, we are hiring care providers to take care of them at home within their environment with where they are most comfortable. We also have walk-in clinics and community health centers, which are federally funded to provide care to low-income and underserved populations. So, some further information about CHCs are the quality of care within CHCs include evidence-based, appropriate, and patient-centered care, which I think is fantastic. That is what our medical system needs. They are constantly improving the quality of care. They emphasize culturally appropriate care, given they are erected in areas that have underserved populations. They have improved health rates, including low birth weight, diabetes, and hypertension, as well as reducing racial and ethnic health disparities. They have a focus on preventative care. And one of the challenges is with Medicaid reimbursement, and there's often an understaffed clinic with overwhelming workloads, which is tough. Some Ireland statistics, I would like to highlight the non-communicable diseases, which is 344, which is pretty high compared to the US. So Ireland has kind of a messed up healthcare system like the US. They have an interesting history of opposing state-sponsored universal health care. Irish people can qualify for medical cards that do provide for healthcare services. These healthcare services are presently controlled by the Department of Health and the Health Service Executive Agency. It seems that the HSE controls more of the hospitals and the actual clinics. So some strengths of the U.S., greater accessibility, reduces unnecessary healthcare costs. They have institutions to measure quality of care, encourages coordination of care, and emphasizes qualities of social justice. We've got some major gaps, and that's the limited scope of CHCs right now. Alternative medicine is still not widely accepted in Western medicine and insurance, and I doubt it will be accepted within public care for a long time. Hopefully not, though. We still have a market justice versus social justice society. Coordination of care is still a struggle. There's a very informative article I will link called Death by 1,000 Clicks, and it is all about the very expensive endeavor to centralize and digitalize medical records within the U.S. and how it was a total disaster and backfired and caused all these problems. Some strengths for the Irish healthcare system: greater accessibility, encourages coordination of care, emphasizes qualities of social justice, very, very similar to the strengths of the United States. Gaps are the waiting times, and it's a very expensive program that Ireland hasn't quite nailed down how to budget because there are multiple systems managing it, very similar to the United States. The U.S. COVID response, so we had mixed media messages. We were influenced by misinformation and propaganda. different states had different regulations, which contributed to our total death and infection rate. So the total deaths, I would like to emphasize, is 596,000. Ireland is kind of an anomaly within this COVID response. So as soon as COVID cases were confirmed, Ireland sprang into action, and I had to double check my reference that it was written in 2021, but the first confirmed case of COVID in Ireland was in February of this year. They had daily announcements and press releases, and they had a general public adherence to safety measures, and they've only experienced 4,941 deaths. The recommendations that I would like to make to both the US and Ireland, because they kind of have similar issues, are universal health care, as well as a person-centered social justice market, as well as one institution to manage all federally funded hospitals, clinics, and community health centers. Thank you.